According to Anna Lily Wynn, as of 2024, every day over 100,000 people die of drug overdoses worldwide. Many of these deaths could have been prevented by one thing: access to a harm reduction center. Harm reduction centers help with drug safety and control, despite what many people have heard. In this speech, I will be refuting the three biggest myths about these centers. I will dive into the effect harm reduction centers have on crime and drug use, hepatitis C outbreaks, and the stigma and moral judgments on them. By the end of this speech, you'll have a clearer view of the true effects, not just the ones doctored to scrap the idea of these life saving installations. But first, let me give you a little background on what harm reduction centers truly are: safe havens for the people who have run out of options. These buildings are places where addicts can go to use drugs in the presence of medical professionals. This makes taking drugs safer and overdose deaths much less common. In addition, harm reduction centers also offer addiction treatment, which many people use after they get comfortable with the people in space. You might be thinking that giving people a safe space to do drugs would make the drug and crime problem worse, but I'm here to tell you it does just the opposite. A common criticism of harm reduction centers is the belief that they increase drug use and crime in the communities where they operate. Opponents argue that providing resources such as clean needles and overdose prevention supplies enables drug use and attracts criminal activity. However, data from established programs refute this and actually show reductions in both. In Barcelona's harm reduction model, outreach efforts directly targeted unsafe drug environments. As Perez-Badel and others report, in 2020, harm reduction professionals provided needle exchange and naloxone to shooting galleries through peers. Naloxone, or Narcan, is a nasal spray that can help save lives by treating overdoses. Rather than increasing drug use, this strategy helped replace high-risk consumption with safer, more monitored practices to reduce overdoses and prevent the spread of infectious diseases. Also, data shows that these programs support going into treatment rather than prolonging drug use. Annually, around 10% of harm reduction clients start an opioid treatment. This is from Perez-Badel and others in 2020. This shows that harm reduction services do not worsen addiction, but instead promote stability and recovery. With consistent findings across multiple years of program evaluation, it becomes clear that the claim linking harm reduction to increased crime or drug use is not supported by any evidence at all. On the contrary, these centers reduce unsafe behavior and create safer environments for both participants and the surrounding community. The positive impact doesn't stop there. By reducing unsafe drug practices, they also help prevent outbreaks of hepatitis C and other bloodborne infections. Harm reduction centers are known for being hubs for hepatitis C transmission. Opponents argue that concentrating people who use drugs in a single location increases exposure and fuels new outbreaks. However, research demonstrates that harm reduction centers implement deliberate, structured precautions that are not only to reduce transmission, but also actively contribute to hepatitis C elimination efforts. Fornes and others explain that people who attend harm reduction centers and addiction centers play a big role in lowering transmission, saying that users who attend HRCs and ACs would eventually help achieve hepatitis C elimination, 2022. By diagnosing people who may have sought care elsewhere and connecting them to treatment, harm reduction centers reduce the number of untreated carriers, the primary cause of transmission. Findings from other harm reduction programs show similar results. When people are provided with sterile supplies, medical monitoring, and education, the reinfection rate slows down. Hepatitis C is a serious public issue, but evidence shows that harm reduction centers are a part of the solution, not the problem. Even with the clear health benefits like fewer hepatitis C outbreaks and less drug use, harm reduction centers still face moral and social judgment from those who don't understand their effects. These moral judgments are usually focused on condoning or even normalizing drug use. Critics worry that providing services such as clean supplies, overdose prevention, or medical care, these centers create the impression that drug use is acceptable. However, this view overlooks the fact that the stigma itself is a barrier to treatment or recovery. Degree and others in 2010 note that stigma can lead to consumers avoiding seeking treatment, affecting their mental health and hindering the implementation of appropriate prevention and intervention policies, showing that shame does far more harm than the existence of supportive services does. Instead of normalizing drug use, harm reduction centers acknowledge that it already exists and focus on preventing the most dangerous outcomes. Evidence from mobile home reductions programs supports this. 1/3 of initial visits to the mobile unit were for wound care, and 26% initially presented seeking other services and later returned for buprenorphine treatment, Pinkover, and others in 2024. This pattern demonstrates that people often need a safe environment before they feel ready to get treatment, and harm reduction centers can build that trust. Also, Paris Bedell in 2020 says that facilitation entry to treatment is not the main objective of harm reduction programs, which means that they do not force treatment on people. It has to be something that they themselves want to do, making treatment much more effective. It also highlights that patients who drop out of treatment or relapse after treatment can use harm reduction services without fear of being penalized. From the outside looking in, harm reduction centers might seem to normalize drug use, but multiple studies show that they instead normalize safety, compassion, and access to care. In the end, saying yes to harm reduction centers isn't about supporting drug use. It's about supporting people, saving lives, strengthening communities. With all the evidence I provided, we've seen that harm reduction centers don't increase drug use or crime, but they reduce both. They save lives by preventing overdoses, stopping the spread of diseases like hepatitis C, and connecting people to the help they need. Yet despite all the evidence, these centers are still judged through a moral lens instead of a compassionate one. Supporting harm reduction isn't about approving of normalizing drug use. It's about helping the people that are struggling the most. So as we move forward, let's say yes. Yes to health, yes to safety, and yes to harm reduction centers. Thank you.